Up next, I'd like to introduce our first international speaker visiting from good old British Columbia, Canada. One of the places I've always wanted to visit ever in my life, but I decided to go to Iceland first. So I'm just grabbing your quick little intro. I want to give a little shine on this Susan here. Susan Chapelle serves as the Director of Government Relations and Affairs for Pasha Brands. She's been both a patient and an advocate for the cannabis industry for over 15 years. As an elected city councilor for 2 terms, as well as a candidate for mayor in Squamish, British Columbia, Susan advocated for and put forward policy to reflect legalization and to help those small businesses involved in the cultivation and dispensing of cannabis to retain their place in the economy. Susan is the Director of Government Relations and Affairs at Pasha Brands and is excited to be utilizing all of her gained knowledge in politics, science, and startups to help keep the small business economics in cannabis viable in a time of rapid industry growth and regulatory uncertainty. As a researcher, because you also research. We got to get that all in. As a researcher, Susan has also published extensively in the area of wound healing and mechanism of manual therapy as co-investigator with Dr. Gregory Bove, and as DC PhD at the University of New England, so she's got some roots here. Her numerous publications and expertise on the subject of healing mechanisms, as well as cities and technology, have offered her the opportunity to speak both locally and globally and right here in the Commonwealth as a keynote and speaker and educator. Please help me welcome Susan Chapelle.
Thanks. I don't really need to speak. You have my entire resume and story now, so just go and sit down. You can enjoy your evening. I just want to, the very first, I wanted to start with a quote from George Bernard Shaw. The reasonable man adapts. Do I need to use this? Can you guys hear me? Perfect. The reasonable man adapts himself to the world, and the unreasonable one persists in trying to adapt the world to himself. Therefore, all progress depends on the unreasonable man. This quote really rang true for me when I grew up in the hospital. I have been using cannabis for as long as I remember. I basically have a chronic illness that put me in the hospital, and I was expected to pass away when I was 19. So that story, for me, I often don't tell it. It depends on the crowd, but why cannabis was so important and access to cannabis was so important to me was because it basically was something that I took, that it was the only thing that I could breathe on. And that may seem like a complete and utter contradiction to smoke cannabis for lung disease. But my respirologist did a study, and 98% of his CF patients were using cannabis to relieve their symptoms for cystic fibrosis. So I've had CT scans, and my lungs are getting better, not worse, and the fibrosis is reducing in my lungs after taking cannabis. And I'm N=1 at this. It's not science, but we're here to talk about basically entrepreneurism. And as an entrepreneur in my life, I've started a lot of businesses, and I can tell you, if I knew what I knew today about business, I would have never done it. I've sweated, I've spent sleepless nights worrying about money and basically barreling into opening businesses because of looking at future economics and where healthcare has to go. Because of my passion for healthcare, I basically opened in a town that was 100% zoned for industry, had no professional zoning, and so I opened the first healthcare clinic that was multidisciplinary in my area. And in order to do that, I had to change zoning, I had to run for politics, and I had to advocate for myself in healthcare. In that healthcare business, I treated with the research that I was conducting, most of my work was on post-surgical breast cancer patients. And all of them were taking cannabis. And in my town, as I was a politician, there was no access to cannabis. All the dispensaries were legal. We had no zoning for cannabis. But as a politician and also just a consumer and not really somebody that was interested in entering the industry because it was illegal back then, I advocated in City Council to have the first dispensary policy in British Columbia that allowed the illegal dispensaries to open with municipal zoning. And it took me 4 years. So it was not a slam dunk. And nothing that you do in advocacy or in entrepreneurism and starting businesses is a slam dunk. There's no clear path, there's no line to follow, and especially in cannabis, because cannabis is an entire vertical economy that's basically been dropped into your states, and with federal illegalness, you still have a lot of advocacy to do. And you know, I keep hearing that Trump, just before the election, is going to announce that he's going to legalize cannabis. And we've taken a cue from you guys. We no longer call it marijuana. We dissuade people from using the term marijuana because even the term marijuana is an unequitable term that was basically used to scare people into thinking it was a Mexican term and it was a fear-based word. So in Canada, we try to just use the word cannabis and not use the word marijuana. When you're opening a business in cannabis, if you've already been running a business in cannabis, you know everything about innovation that you need to know. Cannabis has been one of the most innovative and science-based businesses that we have. It's innovative in agriculture, it's innovative building science, it's even innovative in the research that people have had to do to extract cannabis to actually research it. So researchers that are researching cannabis basically have had to go through hell in a handbasket to get the cannabis in order to be able to conduct research. It's on animal models. Animal models are not the appropriate model because the CB1 receptors are completely different. So the receptors in animals are not the same as humans. And humans have been consuming cannabis for 2,000 years. So there's already been a massive experiment going on. Not a lot of harm. We know that it's not very harmful, although it does have harms in neuroscience, in forming brains. There are definitely harms. It's not a harmless drug. So when opening a business, thinking about all of the things that the illegal market brought, and we also call it the gray market now because all of those people that in Canada are still called the gray market and have no opportunities like you have in Massachusetts with equity. We have no laws at the federal level except for recreation and legalization. We still have no access to medicine. It's still taxed at all levels. So, and the cannabis that you buy legally is incredibly expensive because of the tax situation. So we have a lot to work out. And people point to us and say how grand it is that we've legalized. But we top down an entire industry. We don't have any banking. We don't have any ancillary businesses that are allowed to work in the industry. And the municipalities are basically offering prohibition. It's being offered up in the cannabis industry. One of the things that you have to overcome is this is an agriculture product. It's an agriculture product that's being grown indoors with innovative ag technology, hydroponics, there's tilapia farming going on, there's amazing indoor innovation, and with climate, that technology can be transferred all over the globe. Cannabis technology in places is being used to grow lettuce in third world countries that are basically not able to grow any more food because of climate disruption, I call it, instead of climate change, because it's disrupting everything. So all of the technology that cannabis is utilizing are all opportunities to get into business. All of these things are holes in the market that need to be filled with innovation. And the innovation that can go on is massive, but not without the advocacy. So when I started up my businesses and the financial industry was there for me, I could borrow money, I could advocate for my land use, I could stand up in public and say, I want to open up a healthcare clinic. We still don't stand up in cannabis. We're still stigmatized, so opening up a business in cannabis is massive. To be able to stand up and say, I'm going to open a cannabis business to your family, to your friends, people still view this as outside of the norm. And you don't have the banking systems. So you're not able to borrow money. You have to rely on your friends, your family. You have to sometimes put up your house to get money. And it's not going to be enough. You're going to have to be drawing on other systems. In Canada, we made the mistake, because we have access to federal legal systems, we have IPOs. We have companies that scaled to IPO in 5 months that basically used, at the Cannabis conference, we were calling it just OPM, other people's money. Instead of IPO, it's OPM. And I'm going to actually use that now. But using other people's money comes with great responsibility. You have shareholders to please. And I'm not talking small amounts of money. The money being paid for dispensary licenses, for other people's brands, without looking at contracts, just $14 million here, $30 million here, all money that has to be repaid, and the runway is very short right now. Last week in the news, 600 jobs in the Canadian cannabis industry were gone, instantly gone. People ran out of money because they weren't doing their due diligence to understand what it takes to open a business. It was a gold rush, and everybody put their money into cannabis, and now everybody's getting out because it's an agricultural product. It needs to be grown, it needs to have zoning, and it's a regulatory environment. I have an MBA. When I did my MBA, the first thing instructors told me is don't ever enter a regulatory market. And I of course went immediately into a regulatory market as soon as I graduated. But it was being in the cannabis consultancy where we are trying to advocate for small growers to get into the market. We have ACMPR licenses and MMAR licenses, which is the medical access to cannabis. It's also where all our gray market weed is coming from. So it's all diverted into the dispensaries. It's not regulated, it's not tested, it's full of microbials, it's full of pesticides, and it's causing sickness. And that sickness is being pointed to by the legislature and by the regulators saying people are getting sick, but they're getting sick because of the legal products and not having appropriate cannabis testing. So all of it, there's a lot of barriers to entry, but there's a lot of amazing things. Your patients are the patients of cannabis. The cancer patients and the research that's going on. The science basically is very slim. Right now, it affects sleep, nausea, and anxiety. Those are the only 3 things. If somebody told me that one drug could fix sleep, nausea, and anxiety, that would be a miracle. But we are saying it's a personalized medicine that's going to fix your endocannabinoid system. Those things may not be true. They may prove true, but they've never been true so far, and there's a lot of research going on globally. And none of the things that we're looking at in North America with the new regulated market are actually proving true internationally when you read international research. It's a drug looking for a disease right now. And when you understand all that, you have to be cautious about getting into the industry. The opportunities are massive in ancillary products. They're massive in integrating with larger companies and providing services. They're massive for growers. We looked at your company, American, is providing infrastructure for growers, and that's a massive opportunity as well for development companies, people that have land, providing growers with places to grow, and separating out our skill sets so that we can actually open amazingly innovative industries. And I want to say thank you to your regulator as well. Having an equity model for small businesses and ensuring that you have micro licenses, but not only that, but guaranteeing for 2 years that those people have access to the market before the massive IPOs have access to the market, makes it a lot less predatory. And our farmers we're losing the battle for our farmers right now in Canada because the land use is being taken up by massive companies that can afford to buy up land and basically sit and wait until they get their licenses and then provide crappy weed to the industry. I'm sure you've all looked at pictures online of people opening up their jars and getting sticks and stones in their massive plastic jars. So areas of innovation like packaging is massive. Finding packaging that's recyclable and doesn't fill up our landfills. Helping municipalities to figure out that their values align with the cannabis industry. So not being adversarial, not standing up and yelling at legislatures and being kind to politicians who need the education and need the resources, writing articles and being an education resource like the C3 network and like Anne has done by bringing people together. So I've got to be over 7 minutes by now. I'll leave you guys with that. If anybody has any questions, I'm pretty easy to find online, Squamish Susan. Feel free to get in touch if you have any questions or models you want me to look at. I'm always happy to help small businesses. Thank you so much for Anne.